Hi, and welcome to the 5 Minute Check-in. So, back by popular demand, we're going to do another episode of myth busting. And we heard a lot of comments from our previous episodes, and we have chosen two from the audience. One is the impact of 5G radiation, and the second one is vitamin D. Well, as always, to help me in this discussion, we have Dr. Ankita Sagar, our System Vice President for Clinical Standards and Practice Variation Reduction, also an Associate Professor at Creighton University. Ankita, thanks for coming back.
Thanks. Great to be back.
So, up first is our discussion about 5G radiation and does it cause a brain tumor? So this has been around for quite a while, Ankita, as we know, no pun intended, but kind of floating in the ether here. People have been thinking about it. And so can you talk to us a little bit about this? What's the science behind it and how should we think about it?
Yeah. So I'm going to take you back a little bit and talk about radiation. Let's define it. There's non-ionizing and there's ionizing radiation. Uh,
High school again. Yes.
exactly. Pull out your
Mhm.
high school textbooks because non-ionizing radiation is very low energy, very low frequency, too low to really cause any DNA damage, therefore unlikely to cause cancer. But then ionizing radiation is what we would consider high energy, high frequency, and when exposed for a long period of time, you can cause mutations in the DNA and therefore causing cancer. So that's the basic science part of it, right? When we think about non-ionizing radiation, that's where we have our radios, TV, microwaves, and cell phones. So
Cell phones.
2G
Got it.
through 5G is
Mhm.
non-ionizing.
Got it. Okay.
Yeah,
So we have our high school textbook and we're looking at these different things, but we are clinicians and we're wondering, are there any publications that might help us, kind of prove your point?
sure. So there was a prospective study done in the UK of 1.3 million women that were followed over a 14-year period. What they found was for those women who used their cell phone frequently and for long periods of time versus those who did not, it was no statistical difference in
Mhm.
incidence of brain tumor.
Got it. So
Not
this is
only,
a prospective study, million women, well designed, no correlation between cell phone use. Got it.
no, not at all. Furthermore, there was no difference in the type of brain tumor if they did develop one because of happenstance and they never used a cell phone and they developed a tumor. There was no difference in the type of tumor based on their cell phone use either.
Got it. So, Akata, is it true that using 5G radiation in cell phones causes brain tumors?
It is not true. That myth is busted. So, Tom, you looked into a topic very near and dear to my heart as a primary care doctor about vitamin D measurement. It's the winter. People want to know what their vitamin D levels are so that we can make sure everybody is getting ample vitamin D. Is it important to check their vitamin D and then supplement their levels?
So this has been around for a long time again, kind of like our 5G radiation. And actually, earlier on, everyone was screening and treating, and a lot of vitamin D was being prescribed. And it has always been a mystery whether this is helpful or not. But now we have a great meta-analysis, a summary of all of the literature published by the U.S. Preventive Task Force in the Annals of Internal Medicine. Amazing study. They collated over 1,000 articles, pulled down to 27 that really answered the questions, or at least tried to, or valid. They tried to answer four questions. Is screening healthy? Does it benefit you? Does screening hurt you? Does treating for vitamin D help you? Does treating vitamin D hurt you? Guess how many articles were published about screening for vitamin D?
How many?
Zero.
Wow.
So
Zero.
zero, no evidence. Now, there were 27 articles looking at treating patients with low vitamin D. So that's kind of helpful because, if you screen and you treat, you want to know you're doing some good. And guess what? No benefit for the major outcomes. We're talking fractures, heart disease, cancer. really no benefit was demonstrated in those clinical trials. One area in nursing home dwelling patients, older elderly patients, slight reduction in mortality, a signal. So, not that great of a news. A lot of clinical trials, good summary in the annals, and that's the
Right.
story.
So, for the average person who has a really good balanced nutritional diet, is not menopausal, is it important to check the vitamin D and then supplement it?
That myth is busted.
Wonderful. Two myths busted in one go. Good work. Amazing. Well, thank you, Dr. McGinn, and thanks everybody for tuning in. Send us more ideas, and we hope to see you next time.